This was the scene in an Arkansas hospital back in mid-July, just as the summer COVID surge was taking hold.
You hit the floor running, and most all of us are working extra hours.
At its busiest, the hospital had 70 COVID patients. Today, there are 8.
It's kind of one of these we just hold our breath and wait and see, but it does feel better. It does feel much better as far as there's a lot more hope.
And it's not just Arkansas. COVID case numbers are dropping fast in other hard-hit southern states like Louisiana and Florida. Nationwide, the numbers are down nearly 40% since September 1st.
Can we be hopeful that maybe there won't be a surge this fall or winter?
So there are no guarantees by any means. I am quite encouraged by the decline in cases that we're seeing because many more people have been infected, unfortunately, and now have natural immunity. Also, we know that vaccinations are increasing.
And could go higher when 30 million children between the ages of 5 and 11 become eligible, possibly in the coming weeks.
Is it reasonable to expect that we will reach a point with this virus where it feels less like a deadly pandemic and more like the flu?
I do think so. I think that as we use vaccines, what we're effectively doing is taming the virus. We're taking off the table its abilities to put people in the hospital and kill us.
A lot of people want to know, when are we going to stop wearing masks on planes? When are we going to stop sending our kids to school with masks on? Do we have any better sense of that?
Well, we don't. And it's why I've called really on the administration to develop a COVID control strategy that defines our endpoints, defines what we're working towards.
What most health experts do agree on is that the country is not there yet.
There's still a lot of people who are unnecessarily winding up in the hospital and experiencing deaths that could have been prevented.
Stephanie, we talk a lot about vaccinations. Let's talk about testing for a moment. The administration is investing $1 billion into home testing kits.
Yeah, you know, the epidemiologist I spoke with said she has real concerns about the affordability and accessibility of tests. This investment could help because testing remains the only way to truly track this virus.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.